Now, there's been a dramatic fall in the number of people dying from heart attacks in England. The figure has halved in the last decade, faster than anywhere else in Europe. So what's behind the reduction? In an attempt to find out, researchers at Oxford University analysed the data on 840,000 people. In 2002, there were just over 100,000 heart attacks in England, and just under half of those were fatal. In 2010, the number suffering a heart attack dropped to 80,000, and just 26,000 died from one. Just under half the decline is down to people surviving a heart attack. Researchers say that's thanks to better treatment like stents, in which a small tube is used to reopen clogged blood vessels. It's now given to 85% of heart attack sufferers. The rest of the decline is apparently due to fewer people having heart attacks in the first place. GPs now have targets for checks on things like blood pressure and cholesterol levels. The proportion of smokers also dropped from 27% to 21% of the population over that time period. And despite rising obesity, diet and exercise levels have improved. Well, one of the ways the NHS has improved care for people having heart attacks is to send patients to specialist units instead of their local A&E. I went to Hammersmith Hospital today, who pioneered the approach, to meet Dr Iqbal Malik. So you arrive here, what happens?
What we want to do is to avoid any delay. We're very lucky. London Ambulance is excellent at spotting a heart attack. They deliver to us. We don't want to go to casualty. We want to go directly...
So they're straight in here?
Straight into the cardiac theatre, where you'll get to see a senior doctor, because that doctor needs to decide whether it's correct, it is a heart attack, we need to get on right now, or we've got the wrong diagnosis. And sometimes, you know, it's a serious diagnosis but not a heart attack, and we need to deal with it. But let's imagine it is a heart attack, and what you need to do is to get into the coronary artery, find the blockage, and open the blood vessel up. It's blocked, we're full of clot. We need to get rid of the clot and place a stent in there that acts as a scaffold to try and hold the artery open so it doesn't happen again.
So that takes place in here?
It is. This is the angiogram lab, and so let's imagine a patient's on the table in chest pain and the tracing suggests it's a heart attack. We'll do an angiogram, and we've got one playing right here, and what it is, it should be a big C-shaped artery, but there's no flow going down because there's a big clot in the way. And what we've done is to open up that blood vessel, put a stent across here so that now you can see the whole C.
A stent holds the artery.
A stent is a
open.
meshwork like chicken wire that holds the artery open, much the same as I'm sure Prince Philip had. And what we're doing is aborting the heart attack, and you can often see the patients suddenly get better as soon as the artery opens. And so this gentleman, he'll be able to go home in 48 hours. That was unheard of a few years ago. You'd have to stay in hospital for weeks on end, and actually you wouldn't get this treatment up front.
So what are the other medical factors that have brought down these deaths?
Well, I think it's medication, and in particular the cholesterol lowering tablets. The first study that showed they were useful was in 1994, and although it took a few years for everyone to catch up with that data, they're the most widely prescribed tablet in the world now, and with good reason. The data is very strong that they prevent heart attacks happening in the first place, and when you've had a heart attack, prevent the next one happening. So they're very useful tablets. But of course, on top of that, there's the population changes that we've made. Our diet is so much better than it was 20 years ago, and it's hard to smoke now. You can only really smoke in your own house, and that is very important.
But what about our increasing obesity and diabetes? Shouldn't they be making us more likely to die?
Yes, and also, of course, as well as that, we're getting older. We're living to an older age, and heart disease is increasingly a disease of the very elderly. Although I've seen 30-year-old people who didn't smoke who've had heart attacks. It can happen at any age. As one gets older, you're more prone to it. So although the mortality is going down, the incidence, I think, is going to start going back up again because we're living older, and the time bomb of obesity and diabetes is eventually going to come back to roost.
And what are your predictions going forward?
Well, I think over the next 10 years, what we mustn't do is take our foot off the accelerator. We're trying to push back heart disease, but it's going to come back to us because of the diabetes and obesity, and so there can't be a lack of investment now.